Today I am here on the invite of our esteemed specialist from the cataract, ophthalmology and cataract subspecialty for their 16th annual scientific conference. And as we stand here today, clinic officers across the country are doing their 17th day on strike. The reason as to why we are on strike is the reason as to what has been discussed by those who have talked before me. We basically have 4 issues. One is about the Social Health Authority, exclusion and discrimination. We have the issue of the interns who have not been posted for over 1.5 years. We have the issue of the universal health coverage staff, and we have the issue of the CBA and the return to work agreement of last year. But let me talk about the Social Health Authority. And it's good that we be honest with each other. The problem with the Social Health Authority is not a problem about the program itself. Social Health Authority should be a very good program that is actually even better than the National Hospital Insurance Fund. I have said many times that the problem that we have is the cartels. The cartels that you remember brought a lot of challenges under the National Hospital Insurance Fund. They have regrouped under the Social Health Authority. And part of that is the chokehold that continue to be sustained on the Social Health Authority by the people in the Ministry of Health who are supposed to be impartial advisors on matters of quality of health care. And I think we are reaching a point where we even asking ourselves, would we even probably be recommending that the top leadership of the ministry, the CS, the principal secretaries, that then do not have to be health workers? Because for a few that we have gotten, and especially when you get them coming from one cadre, we are seeing a lot of professional bias.
My address is political, and I want to address 3 people. The first one is in the formulation of SHA. SHA was formulated so that people can access health care. But people have hijacked SHA. And the first people that have hijacked SHA is the Ministry of Health, headed by Director General, who knows very well that healthcare is delivered by 80% by clinical officers. So when you come and you block the person giving 80% of service to the people, and you obstruct him from offering that service, is that service going to be free? That's a question I want to ask Dr. Amoth.
Today we are here attending the 16th annual scientific conference for ophthalmic clinical officers. And in the last few weeks, there's been a lot of information going out, coming from the Kenya Medical Association and the Kenya Association of Obs-Gyne Specialists, that clinical officers are not competent in doing surgeries. And we are here to tell Kenyans that clinical officers are well trained, they have the requisite skills, and they should perform those surgeries because they are being regulated by an Act of Parliament through the Clinical Officers Council, which is the Act number 20 of 2017. With me here are leaders from the Ophthalmic Association, where some of them do cataract surgeries, and they are going to tell Kenyans their competencies, their training, and what they are trained to do, and so that Kenyans can know that clinical officers are competent to do those surgeries.